Hey everybody, Luke Gordon, physical therapist here, and I recently made a video about bulging discs in your lower back that are causing sciatic nerve pain and whether or not that bulging disc can be healed. So in that video, I basically talked about figuring out right off the bat, do you have a bulging disc versus a herniated disc, what's the severity, and if your pain is being caused by a bulging disc, can you treat it, how to figure that out. So in this video, I want to take it to the next step, and we're going to talk about if you do have pain coming from a bulging disc, how to actually get rid of that pain for good and to heal the bulging disc. So again, just a quick recap, one of the most important things from that first video was you really have to make sure that you are confident that your pain, which is typically going to be sciatic nerve pain, that lovely pain starting in the lower back, shooting down the back of your buttocks and the back of your thigh, sometimes as far as the foot. You want to be confident that the cause of that pain is your bulging disc. So if you've already kind of checked those boxes and you're pretty sure you've got a bulging disc, then let's go ahead and move on forward with what you need to do with that in this video. So the first thing that you want to do is very simple. This is a great place to start for anyone with a bulging disc, is you want to eliminate as many aggravating factors as possible. So that means for the average person with a bulging disc that's causing that pain shooting down the back of the leg, again, it's called sciatica. For the average person, it's going to hurt them to sit, and it's going to feel better to stand and walk around. So if you know that it hurts you to sit, then don't sit so much. Particularly, you don't want to sit and be slouched. You want to use like a rolled up towel or a pillow behind your lower back and sit propped upright so that you're not slouching forward. So that's a common aggravating activity that you want to cut down, is don't sit too much. Other common aggravating activities like forward bending, or if you're doing like prolonged reaching or carrying or lifting out in front of your body, any of those awkward or sustained postures that make your disc feel worse and tends to shoot that pain down your leg even more intensely. Avoid as many of those things as you can do. I'm going to share all these things with you in this video about what you should do, but one of the best things you can do is avoid those things. It's kind of like two sides of the scale. On one side, it's the things that are making you worse, and on the other side, it's the things that are making you better. So try to have a good impact on both sides of the scale there. So again, first thing, eliminate aggravating activities. Second thing then is that you want to do what I would call extension-based exercises. Now I've got a whole video on this that I can link up here. I'll link that to the end of this video as well. But simply put, extension-based exercises are when you're standing up and you start to stretch your back backwards. So that's your back extending or arching backwards versus flexing forward, which is typically bad for your disc. When you look at the mechanism of a disc injury, typically it's loading on the front of the disc, which is pushing the disc material backwards and towards your nerve roots. And as soon as that disc bulge touches a nerve root, then you get that lovely nerve pain. I say lovely, of course, tongue-in-cheek, because it's absolutely awful. So that's extension-based exercises really help put the pressure on the back of the disc and then start to push that disc material back towards the center where it belongs. So again, I've got a video on that. The basic ones are a standing extension, laying on your stomach, propped up on your elbows is the second version, and then of course doing a full press-up where you're pressing your shoulders up off the table is the next progression. Again, full details in a different video. So let's just talk about what else works for healing a bulging disc. So extension-based exercise is number 2. The other thing that I think works really well is some type of a traction or inversion. Now, when I say traction, if you can imagine your lumbar spine and you've got your vertebrae, your bone, and then a disc, and then a vertebrae, and you know the disc is between the two bones, and the disc is bulging backwards. Let's say it's this direction. When you go into traction, then you're basically pulling everything apart. So you're pulling the bones apart, you're creating space there, you're pulling the disc apart, and that negative pressure is going to help suck that disc bulge back to the center. It usually feels really good too. So whether you have access to like an actual traction device at a physical therapy clinic or a chiropractic clinic that can actually lay down and actually provide traction, you've got a home unit, or for most people, you could have access to an inversion table. So those are great resources. Again, create that negative pressure, pull that disc bulge back in. Great for temporary pain relief while you're at it, but it's also going to help you really improve that disc and heal the disc bulge and get it back to the center. So that was the third thing, is do some type of a traction or inversion. If you want more information on inversion tables, I'll link that video to this one as well too. We got some really good tips on how to use an inversion table and the parameters for that as well. So that was your next tip. Use some type of traction or inversion. And then last tip for this video is that I mentioned, other underlying causes of pain. You could have facet joint pain. You could have sacroiliac joint pain, which is SIJ pain. One of the biggest things that I see, especially in people as we get a little bit older men especially, but women as well, is that when we're trying to do extension-based exercises and to get that disc to go back into a good spot, If you encounter limited joint mobility or joint pain, which will typically feel like you just go back and you just kind of get stuck there, or you feel like a lot of compression in your lower back when you try to do that, what really helps in that situation then is to improve your joint mobility. And so that typically would involve some type of a manual therapy, hands-on therapy, where like a therapist is mobilizing those facet joints for you, or a chiropractor is adjusting them for you. But if you feel like you're trying to do the extension-based exercises and you're just not very flexible, or it's just not that comfortable because you feel like your joints are just kind of compressing as you go back, that can be a really nice tool to allow you to treat the disc bulge. Because the farther back that you can go comfortably with your spine, the easier it is going to be for you to put that pressure on the back of the disc and move that disc material back forwards towards the center where it belongs, where you won't have that pain, where you won't have that nerve root compression and that sciatic nerve pain that's shooting down your leg. So those are my tips for you. And I think, as with all of these things, especially if you're in a lot of pain, you want to combine as many tips as possible all at once, get as much pain relief, get as much pain and pressure off that nerve as you can as quickly as possible, and then do it over a consistent period of time. One thing to keep in mind too is that sometimes if you've had nerve pain for a long time, even if you're doing the right things to take the pressure off the nerve, it may take you a little while to actually realize the benefit and actually feel better, because nerves I basically think they have like long memories. You can take the pressure off them, but they'll still hurt. So keep doing the same things right over and over and over and over again over the course of days and weeks, and start to tip the scales into your favor. Again, avoiding the things that hurt you and focusing more on the things that help you feel better, and just start to slowly feel better. You want to see that pain kind of centralize, up your leg into your low back, not all the way down your leg anymore. And if you can do all of these things at once, you've got a really good shot at healing your disc bulge. And if they don't work, then you may have something more serious like a herniation. So act quickly on that too, in terms of talking to a doctor or a surgeon if you need to. But just one more positive thing before I go. The average person with a disc bulge can be healed, and you should have a good shot at reducing your pain and getting that disc to heal. So I hope today's video really helped. I would appreciate if you leave a thumbs up before you go, subscribe to the channel, leave me a comment below. I always appreciate hearing from people. Thank you for watching. I really, again, hope this helps you with your lower back pain and sciatica, and I'll be back again soon. Thanks.